happy Saturday. Welcome back to Your Questions, Your Money here on the Fox Business Network. We are the only business network having a good time on a Saturday morning, live answering your questions. I'm Tracy Burns, along with Dagan McDowell.
Having a good time talking about health care. I kid you not.
Swear.
It's because we have such a great panel of people here to answer your questions. Congressman Dennis Kucinich is here. Always a pleasure. Paul Keckley, a healthcare economist with the Deloitte Center for Health Solutions. Pat Powell with the Powell Financial Group. And Peter Pitts, president of the Center for Medicine in the Public Interest. Peter, I know you're chomping at the bit to respond to something, so I'll give you a chance before we get to the email.
Oh, thanks. You know, relative to how much this whole thing is going to cost, you know, $1 trillion over 10 years, and what is that going to buy us? When you ask the American people what health care means to them, they say covering people without insurance. So you have to ask yourself, who are these people? So the number you hear bandied around is 48 million or 50 million. 10 million of those people are illegal aliens, and none of the bills currently on the floor, and I apologize, I haven't read Congressman Kucinich's bill, expressly do not provide care to illegal aliens. That's 10 million off the top. Another 14.2 already today as we speak qualify for government health care benefits but haven't signed up, and half of those are kids. And about another 12 million, this is according to a University of Minnesota study, decline employer-provided health care benefits. These are largely younger people who opt out because they feel they're invulnerable. So you're left with about 15 million hardcore working poor Americans who earn too much to qualify for government benefits, but too little to buy private insurance. So 15 million is a soluble number for which we do not need $1 trillion and a huge effort to turn Uncle Sam into Uncle Sam MD.
That might be what we get ultimately, is something much smaller that just pulls people into the health insurance system, that does not focus on reducing overall health care costs in this country. Something small, much smaller than what we're seeing. That's my guess. But we want to get to an email. How does the health care plan being proposed impact people retiring at age 62 if their employer's insurance does not carry through? Can we get health insurance until Medicare age?
Well, obviously, if there's a gap between your retirement and Medicare, you know, there's an issue. I know some of the bills on the floor provide a bridge between retirement and Medicare. And I think that's actually a very good idea, because right now the whole issue of when somebody retires is a very fluid proposition. I mean, you know, many years ago when people said 65, that was old and you were dying soon. Now 65 is really almost in the prime of life. So it's an issue that's got to be addressed.
And it relates to your income, and if you're making anywhere between $10,000 and $37,000, you're one person, and you're in that age range that the person was talking about, you would be eligible for some kind of a subsidy. If you're making less than $10,000, you'd go into Medicaid until you're eligible to Medicare. That's under H.R. 3200.
But in the meantime, a 62-year-old, with all due respect, because we don't know what the income categories are of the people who are emailing in, and from 62 until you're about 63 and a half, presuming we're exactly 62, you're going to go into either COBRA or some kind of state medical continuation program. That's going to get you half the way there, but the last 18 months are where you're exposed, and then you have to go back, as we talked about with the prior email, you have to go back and look at what is available in your state, because you do need to have something to bridge that, and I totally agree. There are things that we need to have. People need access. They need to have access so that they can bridge these kind of gaps at 65 where you get into Medicare.
Well, Paul, speaking of Medicare age, to fix Medicare, are we going to have to raise the age that people are eligible for it? Is that a solution, part of it?
Well, when Lyndon Johnson in the Great Society brought us Medicare in '65, life expectancies were substantially shorter than they are today. Right. So one way to approach this would be to raise eligibility to 67 or 69. A second would be to means test Medicare, which would mean that certain types of income, like dividends and annuities and others, would be considered, and the premiums would be scaled according to a person's income. So there are a lot of discussions around that. I'd just point out a couple of things. Medicare spends a lot of money on avoidable cost, avoidable readmissions to hospitals resulting from poor perioperative or post-acute care. A lot of what's done in Medicare is unnecessary care. So I think that's a part of the reform discussion. I do want to ask the congressman, though, I'm hearing this phrase, for-profit, quite a lot in your thinking. To my knowledge, the pharmaceutical industry, many other industries in the food chain of healthcare are for-profit. It's where they get their capital. So what do you include when you're describing a third of the system as for-profit?
Insurance companies, I would include their executive salaries, stock options, advertising, marketing, the cost of paperwork. Those are some of the things I would include. I also want to say, in response to what you just said, you talked about, in the Medicare, raising the eligibility age to 67, 69. I'm totally opposed to that, and I think most people in Congress would be. If anything, we ought to take into account that one of the reasons why the workforce is we have an aging workforce, and people, their bodies break down. They maybe should even be covered earlier, which raises a question, answers the question about making people at age 62 eligible. If you start means testing, you can destroy Medicare. I don't think it should be means tested. People should be able to get Medicare no matter how much they make, and if they make a lot of money, then they can help support the program and see that it benefits them too.